Ontario's top doctor is making a call to arms. It's part of a new push this summer to get as many teens and young people as possible vaccinated before they're back in classrooms in the fall. Michael Serapio leads our coverage this hour. Michael.
Good morning, Arthi. And you're right, kids probably have more summer on their mind right now than they do the next fall semester. But with school just 8 weeks away, really health officials have to start talking about what a new academic year is going to look like, especially as more Canadians become fully vaccinated. Now, at this point, the overall numbers look positive. According to the CBC vaccine tracker, 79% of all eligible Canadians have had one dose and 51% are now fully vaccinated, but that number lags when it comes to younger people. Take Ontario, for example. Just 60% of 12 to 17-year-olds have had one dose, and that may have to do with timing, as Ottawa only really did approve the Pfizer vaccine for kids as young as 12 back on May the 5th. But over the last 3 months, 99% of young people infected with COVID-19 between the ages and 12 and 17 were the unvaccinated. And if vaccine pickup does not improve before September, well, Ontario's top doctor has concerns. Take a listen.
They're a key metric because they're the ones that are going to be going to high schools, to colleges, to universities, to workplaces, and potentially, unbeknownst to them, if they're carrying the virus without symptoms, spreading it in those environments. That age group is coming down with a higher rate of disease than other age groups across Ontario.
Now, Dr. Moore also said he anticipates infections will rise in the fall with more people indoors and the emergence of variants like Delta. Well, that makes vaccines even more important. Similarly, Arthi, we should point out that uptake among younger people in Quebec is also lagging, so much so that if numbers don't improve and hit the 75% threshold that Quebec officials want in the province for CJEPs, for example, well, the plan for a full return to in-class learning by the fall may have to be revisited.
So, of course, there is the encouragement of trying to get younger people vaccinated, but there's also discussions about whether or not getting the vaccine should be mandatory during the school year.
Yeah, a big issue right now, and we have to point out nothing's been yet decided because there is a debate here. On the one hand, most schools already have a requirement that kids be inoculated for measles, mumps, and rubella. And to that, I do want to play a bit of your interview from the last hour, Arthi, with Dr. Samir Gupta. Take a listen to what he had to say.
It makes sense scientifically because people who are fully vaccinated, we know, are less likely to get sick. They're less likely to pass it on to others. So these schools are saying that we're trying to protect our staff, we're trying to protect our student body. So it seems like a reasonable step, as long as it's accompanied by strategies to empower people to get vaccinated. We need to make sure that we're giving people every chance to get vaccinated.
So, as we heard from Dr. Gupta, making it mandatory might make sense, especially if you try other avenues as well. But, on the other hand, anything mandatory with vaccines that really only have emergency approval right now may produce a backlash amongst parents. Take a listen to Dr. Rewat Deonandan.
I'd rather we cajole, incentivize, and educate people to voluntarily accept the vaccine rather than to bludgeon them with the brute force of the law to compel them to take it, because then we push away people and maybe push them towards a hardcore anti-vax camp. Making it compulsory at this stage in the game, I think, may cause more societal harm than it does produce public health good.
So mandatory may not be the way to go. Now, that said, we may not even have to get there because there are now suggestions about setting up clinics in schools and, in Quebec's case, CJEPs as well, to get the vaccination numbers up. Bottom line right now, Arthi, there is concern about the slower vaccine uptake among younger people, and that concern is going to grow as we get closer to another school year.
All right. Thank you for this, Michael.
You're welcome.